You've probably heard about that research that says that 90% of startups fail and that 42% of those are because there's no market need. And while 42% is the official cause of death of business, there's another research published by Forbes that says that 70% of all new products fail to meet their projected revenue targets. And this is because they failed or they skipped that discovery phase. So let's make it clear that the enemy is not the market. It's our own cognitive architecture. So we want to stop seeking agreement and confirmation and just hunt for the truth. Welcome back to Clarity Foundations. I'm Just Rusi. I'm the founder of Polymotions. And in this series, we're exploring the science of clarity and how to get your ideas to break through. Last time, I told you need to validate your audience and your idea, but I didn't really tell you how. And if you don't know what you're looking for, you are going to be wasting your time. So today, I want to expand on that idea of validation and tell you a little bit about how we do it at Polymotions. But first, so we don't waste your first step, I want to talk about your expectations and reaching that moment when the audience want your product. And I want to mention this because it's not always so obvious for people that product to market fit, it's a never-ending loop of improvement. And that is important. There's more data, even from last year, that says that up to 70% or 74% of startups fail due to premature scaling. And that means that they started investing on manufacturing and hiring people and created this big business without really knowing if there was enough demand in their market. And that's a huge clarity issue. At Polymotions, we like to do our homework. I personally love the in-depth research phase of discovery and finding out everything you need to know before you start, because that deep research is going to guide your idea. But for this episode, let's assume that you already did your clinical research, or if it's not a medical device, it could be something that's less regulated. Let's imagine you just stumble upon your idea, or it's something that you've been struggling with. And in that case, we recommend the lean product process. We really like this one because it's efficient, it's easy to follow, and it works with minimal resources. So it's great for startups or founders that are just like trying to figure out if they're going in the right direction. Remember, you need to validate two main things: your idea and your audience. This is kind of like a chicken and egg situation. And as you validate one and as you refine one, the other one is going to change. And this is, like I mentioned, a never-ending cycle. So it's something that you're going to be changing continuously as you progress. Let's say you have a rough idea already and you know the problem you want to tackle. I think at this stage, the best thing you can do is not have a detailed idea of what you want to do. The rougher the idea, the better. What I mean with that is that your idea should be about the why. Why are you wanting to do something? So the problem, basically. Maybe a possible what. Like maybe you're thinking of what could work for this. Maybe a software, maybe a device, maybe, you're thinking about the what, but at this stage, you should not have the how. You don't want to be thinking about how you're going to do it. That's too much detail for this stage, and it's going to be limiting you and your validation and your research. So to validate your rough idea, a quick, cheap method that we like to use is checking if people are actively searching for a solution to that pain point that you want to solve. A high volume of searches prove that there's high demand. Like a customer searching for best solution for device sterilization management is concrete evidence that the problem is widespread. If you find that there are already some companies or existing businesses solving that pain point, then better, because that confirms that there is a market and that there is demand for that solution. And you can start there, evaluating that competition. What are they doing? How are they doing it? And who are they targeting? And if you're working in a complicated industry, regulated industry, then this is a good moment to also evaluate how the competition is working against regulatory and economic barriers. How are they solving that, or how they had to adjust their idea to that? And this is just going to give you a good idea of what you're going to have to face, and also the key points you're going to have to be looking at. Okay, so you've done that. You started with your why, you had that. You validated your what, and now you need to understand or find your who. Your rough idea probably targets different type of people, or maybe you even already have a specific group of people. But even then, most of the time, we need to narrow it down even more. That's going to be a consistent thing you need to do during this journey. It's like narrow it down, narrow it down, narrow it down. So let's start there. One of our core values at Polymotions is inclusivity. And the Microsoft design team follows a framework that we really admire. It is built on 3 core principles: recognize exclusion, learn from diversity, and solve for one, extend to many. This means that for their products and for their goals, they're continuously working on creating and improving their accessibility features. And when you do that, you are often improving the experience for everyone. The best example I can think of is closed captions, that they were created specifically for the deaf community, but now they're used by everyone else, simply because it improves the experience. I recently heard of another example I never thought about before, but I really like it too. It's when you go to a building and you see the stairs and then the ramp that was created for wheelchair accessibility. But now you can see that a lot of other people benefit from it. For example, parents with strollers, the delivery guy with the bike, or just somebody who that day they just prefer to take the ramp instead. And at Polymotions, when we are working on a new product or when we're creating something new, even if it's not a physical product, we approach it with a similar mindset, and we recommend you doing the same, especially at this stage. And basically what I'm saying is that you should not be aiming for everyone or even a wide group of people. You should be figuring out who needs your solution the most, and then you design for them. And when you create for the few, you're creating for all. So to do this, we're going to start with creating a persona or an avatar. This is a fun part. It's a fictional profile that represents the specific traits, behaviors, and goals of your target audience. For example, let's imagine a surgical technician who works 12 hours or more, and their hands are starting to hurt at the end of their workday. So knowing your persona makes you think about their actual work environment and their pain points, like high stress, small tools to use, or wearing gloves all day. This guides the questions for your interviews, and it will also give you an idea of what features to test for a design evaluation. If your technician is wearing gloves, then your visual system in your device needs to take that into account. If your device is used in low light, maybe the color palette must meet minimum contrast ratios. Research becomes incredibly important too. And unlike consumer markets where just surveys are enough, in regulated industries, let's say medtech, you need to do an immersion on that environment. For example, this would involve shadowing the doctors, the nurses, the technicians. Is your understanding their environment too, the terminology around this persona, the existing rules and regulations in their environment, even non-obvious issues that they face. For example, a long commute, hard time sleeping at home, stress, or bad habits. So all of that is very important to understand, but you need to be very specific about your objectives as well. Take note of all the issues you see, but you also set limitations for future design work. This will stop you from building overcomplicated solutions and also locks in the scope of your solution. And we'll come back to this in a little bit. You have your persona, your limitations. Now you write your questions. And I mentioned this last time, but I'm going to remind you that you need to stop talking about your idea and start listening. You don't want to tell them what you're thinking about yet. You're going to find the real problems that they're facing by watching them work and hearing about their struggles, but not by asking their opinions about your thoughts. Because people often say one thing, but they actually mean another, or they don't realize that they want something else, or they're too nice. Our enthusiasm as founders and as researchers triggers the subject politeness and the feedback loop corrupts. So you want to be aware of not just the questions that you're asking, but also how are you asking those questions, and not just the answers that they're giving you, but also how are they acting? How is their body language? And this is why I think this type of validations need to be face to face as much as possible. You need to be able to observe. And when it comes to devices and physical like products, you need to be able to observe also critical physical constraints that otherwise you would not be able to know. For example, space limitations in an ambulance, or the availability of power outlets in a trauma bay, the specific lighting conditions in an operating room. And as you're observing all of this, there are two key things that you want to also keep in mind about the product, or if they have an alternative solution for that problem. And the first thing is that you want to take note on how is that product or that device supposed to be used versus how they're actually using it, because this is very common actually that they are using it the wrong way. And then also to how or what problems that device has, what is not working right with that product. And that is something that your solution, your product, or your device is going to solve, it's going to fix. And while we're observing, because there are so many things to take in, and because you're an innovator, and because there are probably many more problems that you expected, you're going to want to solve it all. And you need the discipline to say no to any extra features or any extra things that you want to add to your product that are not in line with your original main promise of that product. And that's when the limitations we said before come in. Saying no is going to protect you and your team and your device or your solution from all that extra unnecessary risk, extra features that you don't need or necessarily want in this first version are gonna slow your development, are gonna create more paperwork than you don't want, and it's gonna probably create some friction with regulatory bodies. Basically, every unnecessary extra, it's gonna be a spot for something to go wrong. So it's very tempted to solve everything and make the perfect product. But for this first version, you want to start with just one thing. You want to solve one main problem and one big innovation. And then just keep in mind that, like I said before, this is a never-ending cycle. So you're going to be able to iterate your product, come up with a 2.0 version, and then you want to be able to include the next feature or that next problem in that second version. But for the first thing, especially if this is your first product, you want to keep it simple and start with just one innovation, one problem, one solution. And that big innovation is going to become your design requirements, your specifications, and you're going to be able to use those limitations you set at the beginning and right now to make or create measurable design rules that your team is going to be able to follow. And you're also going to be able to use those as features to be tested later. And in that way, you have it documented in a timeline on how you made the decisions that make sense, proving that all your design choices were based on a real customer need. So I know it's a lot, and all of that is how to think about targeting your audience, how to create a good experience for them. But then you also need to think about how are they going to access your product. Is it something on a retail store? Is it something that are they going to only be able to get online? If it's a medical device, then is it supplied by the doctor, or do they need to be covered by the insurance to be able to get this? And in that case, you need to confirm that your device can be reimbursed by the insurance, or that there might be other possibilities for people who do not have insurance to access your device. So I know that was a lot to think about, observe, take note on, and it's a lot because you need that to access the data that's going to allow you to start creating. So once you have all that, you can start creating, but you start slow. Something simple, fast, cheap, enough to present to stakeholders or investors. And that's what we call a minimum viable product. This is designed to test assumptions first with minimal resources, but it's also a learning tool. So you want to start with the lowest fidelity necessary. It can be a simple interactive wireframe of a software that you're thinking about. It can be a 3D printed version of a device that you want to test the shape or the form of, or a simple this is how it's going to act scenario test for testing the user journey. For example, let's say a small company is developing a robotic pill dispenser for home use. This stage of discovery might involve a pharmacist physically visiting patients' homes to organize their medications and observe their behaviors. In this scenario, the pharmacist is acting as the robot. So that's validating the problem and the solution value without the cost of building a robot. And at this stage, you can test that low fidelity prototype with a small group of people. And that is going to be enough for you to immediately identify problems with the usability. They're going to tell you what's wrong with it, what they don't like. And then, like I mentioned, you observe the behavior, the environment, everything that I mentioned already before. And then you take that data, you improve your product, and do it again and again and again and again. I mentioned before that early validation is going to allow you to test your device early, fail early, and learn. And all of these while preserving or protecting your investment. And as you go on and you start testing and iterating, you can start improving that fidelity of the prototype as well as the number of people you are testing with. And that starts giving you a bigger picture. But then you go slowly. You don't immediately go and test with 100 people and invest on a very high fidelity prototype. With just a very small low fidelity prototype, you're going to be able to learn a lot. Successful innovators blend innovation and iteration. Innovation is the exciting part, right? The idea of creating something new. But iteration is the discipline, it's what's going to get you from point A to point B. And sometimes while you're testing and iterating, you realize that actually it's not as good as you wanted, so you need to pivot. A fear of admitting a mistake or admitting that their idea was not as good as they thought keeps so many founders stuck. There's a recent study that says that over 70% of startups fail because they're too stubborn to pivot, meaning they ignore the feedback of their market or stakeholders or experts until there was not enough money to continue. So if you find yourself realizing that the data is telling you you're not going in the right direction, but you want to keep trying and trying, stop. Realize that idea may not actually have a market and that investors actually value the flexibility and the maturity to recognize that you made a mistake and that you are able to listen to the market and change your ways. We here think that a pivot is a public declaration of clarity. We think that it proves that you did your homework, right? You did your research, you tested, you measured the results, and then you realize that something needed to change, that your assumptions were wrong. And a pivot could mean changing your target customer, the revenue model, changing the mechanisms of your device, or even just changing the core assumption of your idea, even the why that you started with. Is like realizing that your device may be better for cooking than for surgeries, but it may become a successful product. And if you're successful and you sell, all these principles apply to your second version as well. So I want you to get comfortable with the idea of changing and accepting mistakes and iterations. The market and the investors and your team and your users and everybody is betting on your ability to learn and then adjust as needed. this phase, it would apply to everything else in your business. So just be open to that idea of accepting that things may not be as what you wanted them to be. And also keep in mind, if you're in a regulated industry, that these changes are critical evidence of your progress. Be very specific about this when you are presenting your work for a regulatory body. It proves that you have operational discipline and that all your changes are based on measurable and validated learning. You document the data and then you also update your design specifications. At Polymotions, we use a lot of these validation cycles to create evidence that satisfies regulatory requirements. We work on creating concepts, the strategy, and the necessary steps to mitigate user error while creating a good experience for your target audience before spending money in high fidelity design. This process protects your investment and your reputation. As you map out this process and you gather all your data, you're gonna need to start thinking about how to present it. You need a system to turn your internal clarity into external persuasion, whether that's an investor, a clinical partner, or your audience.